Hey guys, in this video we'll be talking about the muscles of the tongue. So this is the second part of the tongue. If you haven't seen the first part of the tongue, please check out my channel, and in this video we'll continue with the muscles of the tongue. So whenever you look at the tongue is divided into two symmetrical halves by means of a median fibrous septa. So this is the sulcus terminalis, and it is a median fibrous septa dividing the tongue into two symmetrical halves. So whenever you see in the coronal section, this median fibrous septa will be extending posteriorly, and below it will be attached to the hyoid bone, forming the hyoglossal membrane. So whenever you see from the side like this is a median fibrous septa. Below it will be going and attached to the hyoid bone and forming the hyoglossal membrane. Okay, so the muscles present in each half of the tongue. So there are two types of muscles, the extrinsic muscles and the intrinsic muscles. There are four pairs and there are also four pairs. Now what is the difference between these extrinsic and intrinsic? These extrinsic muscles, they will be originating from some bony part other than the close to the tongue and get inserted to the tongue musculature, whereas the intrinsic muscles of the tongue, they are confined within the tongue itself. And these extrinsic muscles, they are responsible for altering the position of the tongue, whereas the intrinsic muscles, they are responsible for altering the shape of the tongue. So very important, intrinsic shape and the extrinsic position. Okay, so you have to remember this. And now let us go to the extrinsic muscles of the tongue. These extrinsic muscles of the So you need not by heart the origin, insertion, etc. So there is a beautiful diagram given in the Vishram Singh. I would like to explain entire origin, insertion with the help of the diagram. Okay, let's draw the diagram. So first draw the styloid process, and then draw the hyoid bone, and then the symphysis menti of the mandible. Yes. Now the first muscle will be the Genio Glosses. The Genio Glosses arises from the superior tubercle. So whenever you see from inside the mandible at the symphysis menti, so you'll be finding four things like this, a four tubercle. These are the superior tubercle, they are the inferior tubercles. So this is the superior tubercle and inferior tubercle. So from the superior tubercle, you will be finding muscle arising. See, this is some fan-shaped muscle which arises from the superior genial tubercle and get inserted to the whole length of the tongue. So whenever you consider this as a tongue, this pink color structure is something the tongue. Okay, so this get inserted into the whole of the tongue from tip to the base. So from the tip to the base entirely it is getting attached, and its lower fibers goes and attached to the hyoid bone. Now what is the action of the Genio Glosses? It causes the protrusion of the tongue. It will cause a protrusion of the tongue like this. And next, hyoglosses. It's a flat quadrangular muscle which arises from the greater cornua and adjacent body of the hyoid bone like this. See? As a flat quadrangular muscle arises from the greater cornua and from the adjacent part of the body of the hyoid bone and get inserted onto the sides of the tongue between the styloglossus laterally and inferior longitudinal muscle medially. I would like to tell this relation with the help of other diagram. For timing, remember, it get inserted to the side of the tongue between the styloglossus and inferior longitudinal muscle, which is an intrinsic muscle. And what is its action? So remember, as it is coming from bottom, it will depress the tongue and depresses the sides of the tongue and causes the dorsal surface to become convex Next, styloglosses, as the name tells, it comes from the styloid process plus adjacent. See, there is some ligament is also coming called the stylohyoid ligament. So this muscle arises from the styloid process plus the adjacent part of the stylohyoid ligament. It's gonna be like this. This is the styloglossus muscle. Now, whenever you see this get inserted to the whole length of the side of the tongue and interdigitate with the posterior fibers of the hyoglossus. This is a hyoglossus. It is interdigitating with the posterior fibers of the hyoglossus. So now, what is the action? As it is coming from the back side, it will draw the tongue upward and backward. And now, the palatoglossus. So, the palatoglossus, the again name says, coming from the palate, a slender slip of muscle which arises from the oral surface of the palatine aponeurosis. Like this, a slender slip that arises from the oral surface of the palatine aponeurosis of the palate, which get inserted on the side of the tongue at the junction between the anterior 2/3 and the posterior 1/3, as it is coming from top. So its action is pulling the root of the tongue upward and approximates the palatoglossal arch. We know on the lateral margin you'll be finding the palatoglossal arch. As it is getting inserted to the sides of the tongue, it will pull the root of the tongue upward and approximates the palatoglossal arch. This is all about the extrinsic muscles of the tongue. So once again, this is the Genio Glosses muscle, this is the hyoglossus muscle, this is the styloglossus muscle, and this is the palatoglossus muscle. Okay guys, so in this video we have discussed about the extrinsic muscles. In my coming video we'll be talking about the intrinsic muscles and later the nerve supply, blood supply, and then close the topic of the tongue. If you like this, please share it with all your friends and do not forget to subscribe to my channel. Thank you.